Hey team, if you experience knee pain while squatting, you need to add these two exercises. Often the knees experience pain when you're wearing out one particular groove because you've got stiffness and or weakness of the ankle or the hip. And these two exercises will challenge additional ranges of motion of the ankle and hip and then allow that knee to have more freedom. The first exercise is sitting to kneeling. You can do this with heavy weights as well as with lighter weights for more repetitions. With the heavier weights, you can hold it on the shoulders, you can hold it against the belly, or you can go overhead with it. When you do this, you're going to access deeper range of motion around the hip, the low back, and then alter how you utilize the knee in this transition. Over time, this additional freedom will start to free up the hamstrings, the adductors, and the muscles that wrap around the calf and go deep down into the ankle, feet, and toes. The other exercise to do are kneeling versions of cleans, jerks, and snatches. By being in the kneeling position, you don't put a lot of strain on the musculature that goes around the knee, but you put additional challenges to the range of motion of the toes, ankle, and feet. And this allows a better rotation of the two shin bones, the tibia and fibula, as well as additional challenge to the toe musculature, both the flexors and extensors, depending on which toe position you're in. By challenging those tissues, but then being limited by what you can do with the shoulders going overhead, it's a great way to have a secondary challenge to that musculature, but not create the primary strain around the knee. The typical strength ratios are going to have the sitting to kneeling be about twice the kneeling ground to overhead. And then a full deep squat would typically fall somewhere in between those two weights. If your ratios fall too far outside of this, you're going to be capable of putting a lot more strain around the knee and then leading to more tissue damage around the knee, which eventually leads to the knee pain that you're experiencing. When you do it lighter for more repetitions, you're going to get a lot of blood flow to the area. That additional blood flow is going to improve the capillaries in the area to make blood flow more possible. But when you've got better blood flow down there, your recovery is faster because the healing hormones and fluids get in there quicker. And so by biasing yourself towards these exercises and creating a better balance, and then ensuring that you have good capacity in the lower weight, higher repetition, will build resilience for the knee in the long run. All right, team, join the movement, stay active.